Welcome to the Move Better, Feel Better podcast. And today I have got the great honour of introducing Hannah Poulton from HLP Therapy. Hannah is the leading scar tissue therapy therapist in the UK currently, and it's a great honour to have you on, Hannah.
Thank you, Jordan. Gosh, I better know what I'm talking about now. What an introduction.
Well, after the course that we went on with you, I can certainly say that I think you know what you're talking about. So first of all, it looked like you had an exciting back end of last week and was doing some stuff in London. What was that all about, if you don't mind sharing?
Yes, so as part of HLP therapy, we obviously have clinics in Leicester. So we treat people's scars and do all women's health and pelvic health. But I also teach courses. So I teach them in the UK and worldwide. And I work closely with Spire hospitals, and I'm training their staff in scar therapy and setting up bespoke scar therapy units within the Spire service, which is great. But as you know, Jordan, I do bespoke scar courses. So, like yourself and your amazing team came to HLP therapy. Yes, I teach you everything there is to know about scars, pretty much, so you can set up your own service. And I absolutely love it. I love teaching. I love empowering professionals just as much as I love treating mums and empowering them in their own care journey as well, or recovery
Oh,
journey.
amazing. So
Yeah.
talking about mums and recovery journey, how many mums, what's the rate of C-sections that are taking place in the UK currently?
Well, C-sections are on the exponential rise, and that's for various reasons, such as we're having babies, later in life, we're slightly larger than we were, a few more comorbidities, past medical history, that kind of thing. And the rate at the moment is I think around 14,000 plus mums a month within the UK. Um, the World Health Organization wanted to keep it around 10 to 15% of all births being C-section. In 2020, during COVID, that cap was lifted by the government because the UK were genuinely sitting around 20% or lower. Um, Now it's grown to 1 in 4, if not 1 in 3, births are C-sections. And Leicester, where I'm from, published their stats only a couple of months ago now, and they're sitting at 45%. So yes, so exponentially, it's growing at a staggering rate.
Would this just off the back of that is, would you say that the support is there alongside those numbers, if that makes sense?
So this is one of my big things, Jordan, as you'll know, because you've spent some time with me. I'm deeply passionate about seeing any individual recover well, but especially C-section mums. I have a personal interest as well as a professional interest. I'm also doing a PhD in cesarean scarring. So, in answer to your question, no, the aftercare isn't there. You have a look at like a simple knee arthroscopy. You'll have your surgery, you'll have a plan afterwards, you'll see the physio, you'll see the surgeon, you'll get follow-up, there'll be guidance, you'll rest. But C-sections are the number one surgery worldwide, so the most common surgery ever performed. And the advice, especially in the UK, in majority of NHS hospitals, is don't lift anything heavier than your baby and rest. Well, it becomes a little bit of a problem then when you have a toddler to look after, when you're a single parent, when you live in the top of a block of flats that you might not speak the language, you might have no support around you. You have all these barriers to good aftercare, and everyone's doing their best. But this isn't trying to be horrible against the NHS or midwife. Everyone is trying their best. But because of the rise of C-sections, we need a rise in aftercare as well. And
Yeah.
even in the form of a leaflet that says, you know what to do, how to look after your scar, what to do in the early stages, pelvic floor activation, breath work, core work, movement, something, just something, Jordan. But I'm on a mission. I will get it through. You just
You're
might.
leading from the front. That
That's
is that
it.
is
Totally.
definitely clear, which is amazing. So as we have already touched upon, kind of like we're changing, everybody's different, but that also means that not every scar is the same, right? Every scar is different. So do you mind talking to us a little bit about the types of scars?
Absolutely. In 20 odd years, Jordan, I've never seen the same scar, A, all the way through, and B, the same kind of scar. And that's because everyone's skin texture is different, skin type, hydration levels, all of these factors, exercise, diet, it all plays a huge factor in your scar makeup and, of course, genetic composition as well. But the three main types of scars that we see for C-sections, obviously you get, contracture scars, from like chickenpox scars and things like that, and burns and scalds. There's loads of scars. But for C-section scars, you're going to have three types. The first one is an atrophic. So that's almost a flat line scar that blends in with the color of your skin. It's like the gold standard of scarring. Everyone wants that. People, come into clinic desperate for that scar that blends in. Not everyone will achieve that, and it's important to set expectations. But that's the first scar. The second scar, 50% of all scars become hypertrophic. And hypertrophic is where the body lays collagen inside the scar border. So you get like this red bootlace approach, like this red line over the scar. And that's when the collagen just keeps laying on top of the collagen, on top of collagen. Now, keloid scars are the most tricky scars to treat. They're the ones that are a bit more aggressive, itchy, and they can spread. And that's when you have collagen on top of collagen buildup, but also over the scar border as well. So it raises up and it raises out. And these hypertrophic and keloid respond very well to silicone and direct scar massage. You don't want to be doing any frictioning over that.
You mentioned there's some kind of common symptoms of itching and that side of things with
Yeah.
keloid scars, but in particular with the C-section population, what's the kind of most common symptoms or complaints that you hear in and around women and their scars?
Mm. So the number one thing, Jordan, that mums come in to see us for is the overhang, the dreaded overhang. So what is that? It's like a shelf of skin over the top of your scar. We everyone calls it something different. A bum bag, a pooch, a shelf, a pouch. We've literally heard it all. And it's the number one thing. And I think that's because, especially if you've not had any of the surgery in that area, it's a shock because the scar obviously is there now and it pins in. You're not pregnant anymore, so that skin is stretched and comes over. And we probably don't say to mums, look, don't panic. This is what it might look like in the early stages. However, these are the things you can do to help it, and we'll talk about some top tips in a bit. But it's definitely the overhang. The first thing is the overhang. The second thing is the itchiness of it. When a scar gets dry, it can feel itchy. When it's healing, it can feel itchy. With those keloids that are wider than the original incision, they draw the hydration away from the other areas of the body so it can keep growing. And of course, that makes everything really itchy as well. So the overhang, itchiness, pain, and pulling, especially on that right side, potentially where the surgeon has finished the incision. It's a deep pulling, it's an ache, it's a restrictive motion, which I think is normally common. And also, mums just come into clinic to see us because they have no idea what to do about their scar. And I think that's where people like yourself, Jordan, and myself are best placed to say, right, let's have a look at it. Oh, we can do scar massage. Oh, what about your hydration? What about your nutrition? Get this good product on your scar. It's going to really help. Um, I think mums just come in because they have no education about this, and it's vital that we give the best education and support.
Definitely,
Mm.
definitely. Just on that kind of restrictive type nature, um, can you just briefly go through why they might feel symptoms elsewhere? So, for example, in pulling into their hip or pressure or something that they go, it's not associated to my, or I don't think it's associated to my scar, but actually we can link it together in some cases.
Yeah, absolutely. So when you come in for a full assessment, and you'll be doing this as well, Jordan, it's so important to look at the person as a whole. As in, mums come in and they get pulling into their diaphragm, so right under their rib cage, they get pulling into their hips, deep into the pelvic floor, round into their lumbar spine as well. And I do believe with our fascial system. So your fascia is that alive, sliding, moving, gliding fascial web that covers us. Because obviously we have a big band of fascia from our chin to our pubic bone and a crossover from hip to hip. The C-section falls within that junction. And I believe as it grows and pulls in, as it's doing its job and healing, I believe it pulls on those fascial slings, however you want to call them, but those fascial connections, and you can feel pulling elsewhere in the body. Now, um, if you've had any other surgeries, breast surgery, laparoscopic surgery, anything like that, what we find is that the scars underneath almost um, match up together. So they match up together and they pull against each other. So we have ladies coming in going, I had my appendix removed when I was, 6. I'm now 39 and I've just had a C-section. My appendix scar is starting to hurt. What's that all about? And I do think the spread of the adhesions underneath the scar tissue do link up and pull together. And I think that has a huge effect on people's pulling and pain. Also, ladies that are very slight and petite hips, and the scar falls in between, obviously, their hip bones, um, then of course the scar sometimes the adhesions stick on the hips and really pull it in. And because of that, you get pain in your hips, you get dull ache in your hips. So it's important. It's important as therapists. We're looking at diaphragmatic breathing, trigger point release, abdominal breathing, looking at other scars. You're looking at pelvic floor. You're looking at the hips, range of movement, and working into the areas that the client really needs release and help with. But yes,
Definitely.
it's definitely not the easy way out, as people keep saying, or it's my big thing, or too posh to push, or all of that. It is a huge surgery which needs good aftercare and advice.
Definitely, I agree with you there. Um, Last kind of question for me really is, what would you suggest to somebody if you had to give them five top tips? Suggest to somebody recovering from a C-section, what would they kind of be?
Brilliant. My 5 top tips. Right. The first one is don't compare yourself, because we always have ladies that come in that go, oh, my friend's had a C-section. Oh, it looks amazing. She's healed really well. Mine's awful. I'm in so much pain. Don't ever compare yourself. We would never compare ourselves to any other symptom or recovery. I always say, if I broke my arm and you broke your arm, Jordan, it wouldn't be a race to see who could heal the fastest or the best. You'd just get on and do your healing, wouldn't you? Uh,
Yeah,
and it's the same, but there's so much pressure on mums, so much pressure. I think that's why they're like, oh, why aren't I doing this? Why aren't I recovering quicker? Um, And just, yeah, and there's so much pressure. So the first thing is don't compare. The second thing is go, my five top tips, go and see a therapist at 6 weeks after your C-section. Make sure they're HLP therapy trained if you can. But somebody that is trained in scar therapy, that understands scars, understands the body, understands pelvic floor, breath, abdominal wall, all of that stuff to give you a full assessment. So, so important to give you scar therapy advice, which is really good. My third top tip is if you're a mum and you're listening to this and you've had a C-section, in the early stages, take photos of your scar because I can tell you it's going to change so much more than you realize. It's not going to be how it was when you first saw it on day one. Take photos and start to look and touch around that scar when you feel ready. I can't tell you the benefits of early intervention for yourself to help touch that scar. And I've even lost count now. Let's just say we're on number four now,
We
Jordan.
are on four
Yeah,
now.
we're
You're
on
completely
number four.
right.
Thank you for keeping track. Yes, good hydration. Get your fluids up. If you're breastfeeding, you'll have a thirst like no other. If you're bottle feeding, I don't care how you feed your baby, but you must keep hydrated, not only for your skin, your hair, which my hair looks like it's I don't know, on fire here. It's the sun is so beautiful. I'm shocked. Um, good hydration, not only for your skin, your hair, your sleep, your eyes, but under the scar, you want to have that hydration. You want, if the scar is pulling moisture from deep down, you want to have that good hydration. So yes, that's that. And the last but not least, know that you've done an amazing job. That would be my top tip. Understand how good you are. Um, we used to
Give
think,
yourself some credit for what you've
totally.
actually gone
Yeah,
through. Yeah.
yeah. We used to think mums were magical who had C-sections, the ones that survived, because back in the day they used it when the mum had died to get the baby out, and then they obviously changed their practices and the mums were surviving. And we used to just think it was a magical way of birth because it was so, so intense. And I think we've lost that. So my last but not least is C-section births can be beautiful, magical. You can make them how you want. Um, and know that your body hasn't failed you and you've done a great job.
Amazing. Thank you, Hannah. I think that's going to be very valuable to a lot of people pre and post C-section. So thank you very much for that. I'm very grateful for your time and for coming on today.
No problem at all. Thank you very much for having me, Jordan. Thank you.